Thank you all very much for being here. My name is Kara Gallardi, and I am the director of the March of Dimes NICU Family Support Program here at the March of Dimes. I have the great privilege every day of working with NICUs and families across the country. And we know that under any circumstance, a stay in the NICU can be very, very challenging for you as a family. But we know that the COVID-19 pandemic has added to that challenge for many of you. So we're very proud today to be able to have two great speakers with us to provide really important information. The information you're going to hear today is an extension of the March of Dimes NICU Family Support Program, where we partner with hospitals around the country to educate families, educate staff, and improve the NICU experience. You'll see that today we are on we have a 5-week series, and we're on session number 3 of that series. You can use the link that you have for this presentation to access any of the other future presentations that you can see on your screen right now. However, if today is the first session that you've joined and you'd like to be able to listen to and view the recording from a previous topic, you can see our first 2 weeks were germs in your NICU baby and self-care during a crisis, that you feel free to chat in the section that will stay just with me and the March of Dimes and we'll be able to send you by email a link to those previous sessions. So if you're interested in having those previous sessions, just chat in your email address and we'll be able to get that information to you. All of the topics that you're seeing here in this series are from the March of Dimes NICU Family Support Core Curriculum Education. And this series and this curriculum of education went through a nationwide 18-month evaluation. And the results of that evaluation showed that parents who participated in these sessions resulted in having an increase in their parenting knowledge and their parenting confidence. And what parent doesn't want to view something or be a part of something that can help them feel more confident at the end of it? We all certainly do. So today we're going to be presenting this information on caring for your baby in the NICU with a special lens towards the impact of the COVID-19 pandemic on NICU families. So with that, we're going to do a few quick housekeeping things and then we're going to get started. So first, we want to get to know a little bit more about you and who's on the call today. So we're going to have a very quick poll to know about where you are in your journey. So give it just 1 second, you'll see the poll come up and we're asking you, are you a current NICU family, a graduate NICU family? Are you possibly anticipating a NICU stay? Or are you one of our tremendous healthcare staff or partners working with families? Please answer the poll and then we'll give you a minute to do that and we'll move forward. Great. So if you could give it just another few seconds to have you all continue in the poll and finish that off, and then we'll get that closed up and we'll move forward with just a few other housekeeping things and we'll jump right into our session. Wonderful, great. So you can see that we have a wonderful representation of NICU or healthcare staff, which is always fabulous. We do have some families who are with us who have a baby who's currently in the NICU, and also those who are anticipating that your baby might need a NICU stay. And we're thrilled to have all of you. And this information really helps our panelists be able to address questions and anticipate questions that you all may have. And there'll be time for that at the end. Great. So with that, we're going to do our last bit of housekeeping. And first is to just let you know that this presentation is being recorded. We had a very high level of interest, but obviously given the nature of this topic, we have folks and families who couldn't be with us right now at this time, so that we wanted to make this recording available so that they can still benefit from the good information that's going to be shared. To chat in your questions, please use the chat function at the bottom. and really feel free to ask anything that you need. Those questions are going to go right to our March of Dimes team, and then we'll be able to direct those over to Dr. Lancey and Lori Gozer, who you'll meet in just a second. And then last, before we meet our speakers, please know that the March of Dimes materials that you're going to be hearing and seeing today are for information purposes only, and that they are not to be used or construed as medical advice. And please always, always seek medical advice from your healthcare provider. Wonderful. So with that, I'm going to introduce our wonderful speakers who have graciously joined us today. And I'll start with Lori Gozer. Lori has a master's degree in counseling, psychology, and she's a certified patient experience professional. She's been with the March of Dimes, contributing in tremendous ways for more than 12 years now. Lori is a proud mom of 3 and new grandmother as well, and she brings both tremendous professional and personal NICU experience to her work. Lori, thank you so much for being here, and Lori is also the March of Dimes NICU Family Support Program Coordinator at St. Louis Children's Hospital, and we're thrilled to have you with us, Lori, today.
Thank you. Thank you so much, Kara. I'm really excited to be.
Lori, 1 sec, we're going to introduce Dr. Lancey, and then I'm going to throw this right over to you.
I think I'm anxious to get started. Go right ahead.
I love that about you, and that's no problem. That's a great place to be. Wonderful. So Dr. Lancey, thank you so much for being here. You have are a recently retired neonatologist from Pittsburgh. You've worked with multiple hospital systems across the state of Pennsylvania and have an incredible passion for both educating and supporting NICU families. And you've been a tremendous source of support for us in this series to support families. So thank you so much for being with us today.
It is my pleasure, Kara. Thank you. And I don't know that Lori looks old enough to be a grandmother, but I'm old enough to be a grandfather a couple times.
Well, I think you both look great. So with that, I'm going to hand this.
I am talking from sunny Pittsburgh. As you can see, it's very sunny. So it makes my hair look white.
It's just the sun, and it looks great. So with that, Lori, thank you so much for being here. Thank you, Dr. Lancey, so much for being here. And with that, Lori, I'm going to officially now hand it over for you to get us started.
Well, and thank you, Doctor, for that comment. That's going to make my day pretty much. Hi, everybody, and welcome. And thank you, Kara. I'm really excited to be here. And welcome to this March of Dimes NICU Family Support Education Program. Like she said, my name is Lori Gozer. I'm the March of Dimes NICU Family Support Program Coordinator at St. Louis Children's Hospital. And today we're going to talk about how to care for your baby in the NICU. So parents and caregivers have an important role in the NICU. Today we're going to talk about ways you can be involved in your baby's care. You'll learn about things like how to clean your hands in order to keep germs away from your baby, how you be involved in your baby's care, and where you can get support and help while your baby is in the NICU. We're going to go over some of the basics today, but please know we do offer classes that go into more specific detail on some of the ideas that we will talk about today. If you have any questions or want to get more information, feel free to chat that question in. You can talk to your nurse. You can attend more of these classes, and you can also take a look at the March of Dimes My NICU Baby app, which we'll talk about a little bit later in more detail, or the March of Dimes website for information on what to expect and how you can be involved, NICU staff, common health conditions, things like that. When it comes to NICU policies, every hospital has their own rules and policies to keep families, babies, and staff safe. Obviously, that's the #1 priority. And they help the NICU to run smoothly and keep everybody informed about what they can do, and then also some things that should not be done. One of the most important policies about when parents, family, and friends can be in, one of those most important policies about when can family, when can parents, when can friends be in the NICU. With COVID-19 and everything that's been going on, your hospital's policies and family presence policies are likely to be more strict than they normally would be. It's incredibly important during this time that you ask your NICU staff about what their rules are and make sure you're following them. When you spend time with your baby, be sure to wash your hands thoroughly, follow any hospital or NICU policies about wearing protective equipment like a mask or a gown. Keep in mind these requirements are likely to change over time as the current pandemic resolves, and they may change as needed at other times of the year as well, such as cold and flu season. As stressful as these times are, and as these changes can be, it's important to remember that these infection control rules are in place for your baby's safety and protection. Everyone has the same goal, to make sure your baby grows and goes home with you healthy. In addition to learning about the hospital family presence policies, there are several other important policies or rules to learn about. Your hospital probably has a specific way to conduct rounds. Rounds are when the medical team discusses your baby's needs and care decisions. Some care teams have these at the bedside. Some may do rounds in an office. The way your NICU is set up may influence those decisions. You can ask at your hospital about when rounds are held and how you can be involved. During the current pandemic, many hospitals are holding virtual care team meetings for families to make sure the parents stay informed. Your hospital will also have a specific policy about shift change and how your baby's nurse passes information about your baby's needs and care to the next nurse. And this is something else that's great to ask about, to find out when and how this is done and how you can be involved. One other thing to ask about is, as it says right there, is cell phones. Many units ask parents to keep them on silent or to take a call outside the room or the bed space. Much of this will be dependent on how your NICU is laid out as well. The goal is for babies to have a calm and quiet space. You might also be required to clean your cell phone when you come into the unit. Some units I've seen have families put their phones into a clean bag and keep it in there whenever you're in the NICU. Just remember, our cell phones carry a lot of germs, and it's really important to keep those away from your baby. The next thing we're going to talk about is really about how to clean your hands. And this is something we've heard a lot over the last few weeks, especially, wash your hands, don't touch your face, wash your hands, don't touch your face. But there are some specifics kind of on the how to make sure that you're doing a thorough job. And every NICU is going to have their own hand washing policies. So be sure to ask your NICU staff to show you or tell you the right way before you see your baby. Some NICUs I've seen have a big scrub sink, like the one you probably see in that picture. Some have smaller sinks at the bedside. I've been to some NICUs that have a foot pedal to control the water. So check with your NICU staff to see what you should do at your hospital. And making sure your hands are clean is just really something you can do to protect your baby and the other babies from any serious infection. So you can see on the screen, we're going to talk a little bit about some of the steps, just the basic steps to hand washing. First, to take off any jewelry that you might have on your hands or your wrists. Next, roll up your sleeves so you can clean all the way up to your elbows. Wash every part of your hands with soap and warm water, keeping in mind between your fingers and your palms and the backs of your hands, and then wash your wrist up to your elbows. Don't forget to clean under and around your fingernails, and make sure you wash for at least 20 seconds as recommended by the CDC to remove dirt and germs. This is about the amount of time it takes to sing the happy birthday song twice. If you've been on Facebook or social media lately, you've probably seen 1,000 different songs that can go to that you can wash your hands to. So whichever song of your choice, keep that in mind. Some NICUs also might have a clock or a timer next to the sink to make sure that you wash long enough. So whatever works is great. You should always wash your hands when you enter the NICU, but there are other times you need to wash your hands as well. So if we could do a quick poll about this, take a look at the poll. It's going to pop up and choose as many answers as you want. Let's think about other times that you might want to wash your hands. And we'll give a few minutes for kind of some of the answers to pop in. Okay, that's great. I see poll responses coming in. That's wonderful. And you all have the right idea. This was not a trick question. These are all great times to wash your hands. After you sneeze, cough, or blow your nose, before and after you change your baby's diaper, after you touch any area of your body that might have a lot of germs, like your nose, your mouth, face, hair, after you go to the bathroom, after you touch any electronic devices like your phone, camera, computer, tablet, any of those kind of things. After you touch your purse, jacket, or shoes, think about where you might put, especially with these items, think about where you might put them during a typical day. You know, on the floor, on the seat of the car. I mean, they could go in a lot of different, you may set those down a lot of places and where germs might be found. You know, when you're handling those things is another great time to wash your hands. And you can see here by the results of the poll, yeah, pretty much all the above, Thank you guys so much for jumping in and participating with that one. There's lots of talk, lots of questions about hand sanitizer over the last couple of months, especially. An alcohol-based hand sanitizer with at least a 60% alcohol content works for removing germs like bacteria from your hands, as long as your hands aren't visibly dirty. So it's important to keep that in mind, that for it to be effective, when you use a hand sanitizer, you need to put it on your hands and put enough of it on your hands that it takes a full 30 seconds of the rubbing action to make sure your hands get dry. You can use hand sanitizer, especially when you're doing things just like touching that jacket, your purse, your camera. But keep in mind, if your hands are visibly dirty, or if you have used the bathroom, then you still need to use soap and water. We're going to talk a little bit too about next about kangaroo care. Families are a key member of the NICU team, and so in the next few slides, we're going to go over ways that you might be able to be involved in your baby's care. So you'll want to talk to the staff at the hospital about how you can safely bond with and care for your baby. Providing kangaroo care is probably one of the most comforting things that parents can do for their babies. For those that don't know, kangaroo care just involves putting your baby, dressed only in a diaper, on your bare chest, kind of like you see in the picture there. When you do this, you want to be sure to have a blanket over your baby's back to keep them warm. Hopefully you've had a chance, if you are currently in the NICU or have had that experience, you've had a chance to do this with your baby. Keep in mind, though, babies still benefit from this even when they're growing and they get a little bit bigger and become healthier. There's lots of benefits to kangaroo care. Benefits for your baby might include being more comfortable, being less stressed, being less likely to get an infection, better brain development, better sleep, better weight gain. I mean, it goes on. There are also lots of benefits for you as a parent to help you to feel closer to your baby, to bond better with your baby, to reduce your stress as well, to increase your production of breast milk. And this is also something that really can improve your confidence as a parent. If your baby isn't ready to be held, there are still ways you can be close to them and give them that still, gentle touch, as you can kind of see in this picture. And I love this term. One way to do this is called hand hugs. Right now, this is like such a comforting term, especially. Sometimes you'll hear it called containment hold or hand swaddling. To do this, just like in the picture, you place very light pressure on your baby's head with one hand, and then your other hand can go on the tummy like it's shown here, or gently down, like cupping the baby's feet. When you touch your baby, you don't want those like quick strokes. That can be really overwhelming for babies. Doing hand hugs can calm your baby, and it's so rewarding from a parent's perspective to see your baby breathing and feeling calmer because of your touch. This is such a great thing during a NICU stay where oftentimes as parents, we feel so helpless. This is one of those, one piece of medicine that you can provide. Again, although be sure to follow any policies your hospital has put in place, especially since COVID-19 pandemic began. These policies are there to protect your baby from germs like the coronavirus. Doing things like kangaroo care, feeding, pumping breast milk, these are things that can help you feel closer to your baby, and you'll get more comfortable caring for your baby if you're involved in their care. So ask lots of questions. Ask doctors and nurses about anything you don't understand. I'll go say that one more time, just ask lots of questions. Learn as much as you can before you take your baby home. I always encourage parents to keep a list of questions. I will say when my youngest was in the NICU, I felt like I always had a million questions in my head, but then the doctor or nurse would come in and I could not remember a single one. I just was in the moment, and as soon as they left, I would remember all the questions again. And so the one piece of information I would definitely recommend is to keep a journal handy wherever you are, and write things down as I thought of them. I would put it on the nightstand so that when I woke up at 3 a.m. with that question, I could write it down, or in your car, or wherever you are, keep it handy so you've got a place to list all those questions so you had them ready when you talk to the doctor. If the hospital policies limit the amount of time you're able to be with your baby, talk to your NICU staff about ways you can bond with your baby. Some NICUs have technology, especially now, for you to be able to virtually connect. This may include things like a camera system or some kind of video software like Zoom or FaceTime for virtual medical visits. Let's go ahead and try to use the chat box now. So we've talked about a couple of ways that you can be involved with your baby's care, but think about other ways and other things you can do to be involved in the care of your baby in the NICU. And go ahead and chat in some of those ideas. And we'll give a few seconds for a few of those to start coming through here. This is great. I see them starting to come in. I see reading to your baby. That's a great idea. Exactly. I see now, like giving baby a bath, changing diapers. This is great. Yeah, anything you can do to be involved in the care of your baby. Taking temperatures, starting a photo album, doing the hand hugs. Those are all great ideas. That's great. Thank you. One thing that's going to be important to keep in mind is support. Support is going to be so critical when you're going through the NICU experience. Think about who might provide this for you now. This could be family, this could be friends, someone from your church or your community. Also keep in mind the NICU and hospital staff aren't just there to take care of your baby. They can also be a great source of support for you. This could be your NICU family support person. This could be your baby's nurse. It could be a social worker. It could be a hospital chaplain. Keep in touch with the people who care about you. Staying connected is important and can help you out through this time. This can be a challenge right now with all of the restrictions due to the pandemic, but things like calling, texting, using social media, using video tools like FaceTime or Zoom, all of these things can help you stay and feel connected. So take a minute and think about the people in your life that can be a source of support for you. And also, when you think about those people, think about ways that they might be able to help you. A friend or a family member who maybe lives far away might be able to help you process what's going on through a phone call or a video chat. Your neighbor might be able to help with the groceries or help you take care of the lawn. You know, it doesn't have to be something big. Don't be afraid to ask for help even with the small things. getting help with several small things can lead to a big relief of stress for you. One great place to get support from other families who have been through the NICU experience is from the March of Dimes. The March of Dimes Facebook community is a group where families from everywhere can come together. They find support, comfort, they make friends. It's a great place to connect and get advice about the challenges that you're experiencing and learn about all the resources that are available to you from the March of Dimes, both nationally and also, in your neighborhood. Share Your Story is also on here. It's a welcoming place. It allows families to share what they've been through and connect with other moms and dads who understand firsthand the challenges and the successes that can happen throughout the journey of a pregnancy. You see lots of resources listed up here on the slide. You'll find information on all of these things through our online community page on marchofdimes.org. Be sure if you go there to search the title Online Communities to pull up these resources. That's the only way when you go in and search it to be sure that you're going to get the links to all of these things. I will encourage you to check these out, and following today's call, we'll email the link that's listed above to all of you, so you'll have a quick and easy way to get to that. So I'm just going to kind of summarize a few things to remember. Number one, obviously follow your hospital's hand washing policy to keep germs away from your baby and you. There are lots of ways that you can take care of your baby while they're in the NICU, including touching and holding them, reading, changing diapers, feeding them. I think I probably said this 2 or 3 times in my last slide because this is my biggest piece of it. Ask lots of questions. Don't be afraid to ask lots of questions. And just remember that you are an important part of your baby's care team. It's not just the doctors and nurses taking care of your baby. You are a part of that team. And that's just a really important thing to remember going forward. I said a little bit earlier that I would talk a little bit more about the NICU Baby app. This is a great tool that you can use that provides answers. There are lots of tools on there, and there's support. It can help you focus on what's important right now, and it will let you learn on your own schedule. Some of the features of the app are listed there. Families in my NICU really love the app, and they talk about how helpful it's been for them. Some of the things that they really like in particular are the trackers, where you can keep track of your feeding and your weight gain, kangaroo care sessions. They also have a lot of fun playing, to be honest, with the photo filters. So it's a little nice thing to the side. And they also use a lot, there are also books loaded onto the app that you can read to your baby. So like we talked about, one of those things that you can do at the bedside is reading. There are books right there on the app. And also lots of information and parent education is on there. So I would highly encourage you, when you get off this call, if you haven't already, download the app and just take a look through. You can look and get some information on the NICU in your area. If you are one of those families that's on this call that indicated you expect you might be going into a NICU, it's a great opportunity for you to look ahead of time and kind of get some of this information and learning done now while you're waiting. It's one of those things that might help with that helpless feeling a little bit and just help you feel better prepared when you do need a NICU stay. I just want to thank you. Thank you all so much for joining today. I'm so thrilled that I had the opportunity to connect with all of you, even if it's virtually. And I'm going to turn it back over to Kara in just a minute. We're going to facilitate that question and discussion portion of the webinar. Kara?
Great, Lori, thanks so much for all the great information. I'm sure it was helpful to everyone who's been able to participate today and those who will watch this in the future. we're going to give everyone a minute to really take Lori's, one of Lori's big takeaways, which is to ask questions. So please take a minute now and chat in any questions that you have. And as they come in, Dr. Lancy, I think you're going to be up first from what it looks like right here. We have a question here for you. So
Eric,
please.
Can I make a few comments before?
Of course,
To
please.
back up what Lori has said. One, it is important that you feel just as important in the NICU with your baby. It is a scary time. People are wondering, how can I touch my kid when the skin's so thin, when there's a monitor here, when there's oxygen there? It is very, very, very important. After 40 years and 20,000 babies, the families that are most involved in participation in the nursery as often as they can, holding the baby, touching the baby, singing to the baby, reading to the baby, those babies do better. I can't tell you exactly why, but in my lots of experience, it is true. The families that can't make it in, the nurses try to do whatever they can, but it's not the same as having a mom, dad, even a grandma, this is before COVID, there to be able to spend that much time talking to singing. The other thing is keep a journal and ask people their name. You're holding your baby or you're not holding your baby's on CPAP. Somebody comes in and says, oh, I'm just going to adjust the CPAP. And you can say, excuse me, who are you? Are you a respiratory therapist? Are you a nurse? Are you a doctor? Are you the plumber? I mean, and then write down that name so you can remember that. The other thing, it doesn't hurt to bring in snacks for the nurses every once in a while. That's just a side issue. But I can only tell you, you might not be able to kangaroo until the baby is more stable. Every unit has different opinions and different policies, but keeping a journal, knowing what it is, become involved in your baby's care, that's the major thing that you can do. And if you can at all participate in rounds, I think a really good NICU has parents participate in rounds. Not if your unit doesn't because of COVID or something, but you know this baby, you're with this baby. The nurses are there 8, 10, 12 hours. The doctors are there 15, 20 minutes. But you can, so many times a parent will say to me, something just isn't right. And yes, the nurses, there's no more apnea or bradycardia. There's no different in the temperature of the baby, but something isn't right. And the parents oftentimes will be correct about that because they know this kid, they know the color, they know everything. All right, those are just my comments before the questions.
Dr. Lancy, those are great comments and thank you. And while you've been sharing that great feedback, we've had some really great questions come in, and this first one is definitely for you, Dr. Lancy. So the comment here is that there's a lot of great information available for families, but that, as you said, sort of each state or each hospital is going to have a different experience or set of policies and practices. What do you recommend as the most reliable resources for families to get information during their NICU stay?
One, the information from the March of Dimes that showed the links that you had up there before, and I'm not getting paid to say that. The other part is the nurses and the specialists. The American Academy of Pediatrics has something called healthychildren.org, but it's not specifically about NICU. There are lots of books out there to read, but I think if you can trust your instincts, get as much information as you can. Talk to the nurses. Some of the nurses you'll get along with great, some you won't. Same for the doctors. But if you can trust the nurses, and the other source is family members who have, not family, but other people who have been through this. Our hospital used to keep a list of parents that were willing to talk to parents whose babies were now in the NICU. These people have graduated from the NICU. They've been home, some of them as long as 8, 10 years ago, but they are available to give them their phone number, make sure they get in touch correctly and talk to them. So those are the suggestions that I have.
Wonderful. Thanks, Dr. Lancy. We're going to keep going because this next question is for you, and then Lori, the one after will be for you, just so you're ready. Dr. Lancy, for a family who is, as you just mentioned, either at home or recently going home, what can you talk about what is the importance of follow-up care for a baby, and what do you do specifically if you have a need for home health or a follow-up appointment for a pediatrician?
Okay, pediatricians that I have talked to around this state and probably around the country have all altered how they see kids. Newborns are recommended to be seen within 2 or 3 days after they go home from the NICU. And there'll be a lot more visits than this if you have a child without it. Oh, we'll go in at 2 weeks, then 2 months, then 4 months, get immunizations. But preemies, especially if we're worried about their weight gain, if they're home on equipment, oxygen monitor, have to be seen more frequently. Every pediatrician's office that I talk to has changed their situation. No chairs in the waiting room. People that I talked to today said, oh, if we have people in the office, we just have them wait in the car, text them when it's safer to come in, when there's no sick kids waiting, and gives us a chance to clean up. Some people see newborns the very, very, very first thing in the morning. The group I talked to today actually said they tend to do it at the lunchtime. They're wearing masks, the nurses are wearing masks. They ask the mother or father, whoever comes in, to wear a mask. Obviously, babies can't wear masks. You have to be at least 2 years old to wear a mask for COVID. Yeah, and physically able to take off the mask. If you have limitations where a 2-year-old or 3-year-old couldn't do that, they shouldn't be wearing a mask. I tend to ramble. Did I answer the question?
No, you did. So it sounds like for a family that's either home or soon to be going home, you're definitely saying, with either home health care, if there's anything else you want to add about that. And certainly thanks for clarifying about what a pediatrician appointment might look like.
Home health care, if you can. They're visiting nurse associations. Sometimes your hospital have them. Sometimes they're from the county. If you can get the same person rather than somebody new every couple of days, if they're coming in that often for weight checks or pulse oximetry checks, if you can get the same person, that's great. At the very beginning, you, the parent, the mother, the father, the significant other, will know this baby better than the professional. And I keep saying that. You'll know, what are the retractions like? What's the normal sleep patterns? What's the normal eating patterns? What's the normal color? And if it's changed, especially if you go home with oxygen, your baby's going to still have some retractions. And they may flip out the visiting nurse or the visiting healthcare provider the first time thinking, whoa, were those tractions normal? I said, oh, you should see 2 weeks ago, they were much worse. We're improving, we're proving our oxygen level is lower. Get the names of everybody. And it's just nice to be able to say, oh, come on in, Sarah, or Jack, whatever, whoever is the visitor. And so they can do that. Same person, and they need to follow the rules in your house. If your rules are you take off your shoes, you take off your shoes. There's no reason to track mud in and make more work. If you can get the same time every day or convenient to your schedule, that's great. They'll have to make some adaptations, but to say, you're coming at 2 o'clock, my 2-year-old just goes to sleep at 2 o'clock and you've woken her up the last 3 times we were here. Can we either make it 1 or 3:30 whenever she wakes up? Don't be afraid. You are your baby's best advocate that you can possibly be. It is your child that needs to be protected, especially after being in the NICU. You'll get some advice from them, and after a while, if it's the same person, they will be very helpful. And sometimes, you look at your baby and say, ooh, what's that? And say, that's just the sternum sticking out a little bit, the xiphoid process. And people used to bring their babies in and they worried about it for a week, but it was that little bone that we have here. And it's like, why did you worry about that? But it's just something that they didn't see when the baby was in the hospital.
All right, so helpful, Dr. Lancy. Thank you so much. That's great. And again, as we're saying, please continue to keep these questions coming. We have a few more. And Lori, this next one is for you. Very timely. Social distancing and social isolation. NICU families are certainly at an increased risk. Can you share your recommendation about how a NICU family can care for their mental health during this time?
I feel like mental health for a NICU family is a challenge anyway. It's one of the most stressful things that you're going through probably ever. And it's made even more so I feel like, by what's going on with the pandemic right now. One of the number one things, I'll just start off by saying, make sure that you're going to your postpartum appointments and just be as open and as honest as you can be with your provider about how you're doing. Because that's going to be one of the first places that you can go with something like anxiety or the starts for postpartum depression. That'll be sort of the first stop for, something that might be a little more than the average amount of stress or anxiety or things like that. I feel like it's so important and so difficult to do when you're a new parent to remember to take care of you. There's rightly so tons of focus on baby and making sure baby's doing well and that everything's taken care of, but keep in mind you've got to take care of yourself in order for you to still be a good resource for your baby. So finding support where you can, like we mentioned a little bit earlier, whether that be friends and family, whether it be in online communities, through the March of Dimes, wherever that support may be, find that support, find people to talk to, and then make sure that you are incorporating some things in to manage your own stress. Things like taking a quick walk or writing in your journal, even if you just stop and take a few slow breaths. One of the things that I recommend sometimes to my NICU families, and sometimes I just provide it for them, is just a list of stress relief tips, things that are good to do, like taking a quick walk, stretch, connecting with friends, writing in your journal. But I feel like having those things written down and posted or set out somewhere that you can see, that second piece is pretty important. Because I think if you ask someone, oh, well, these are the things you should do, they could probably rattle off a few. The question is remembering to do those things or thinking about doing those things when you're in the middle of it. So I'd recommend to a few parents, post it on your bathroom mirror, put it in your wallet where you're going to see it when you pull something out, or in with your laptop, or as a screensaver on your phone. I mean, any of those things can work as a great way just to see it, and then pick one thing on the list and do that. And when you see it later, pick one thing on the list, and those little things can really add up to big time stress relief when you do it on a consistent basis.
That's great. Thanks, Lori. Dr. Lancy, this next question is for you, and I think you've mentioned this already, but it certainly, again, is a timely question and bears repeating, and certainly anything else you want to expand on. But the question is about masks, and at what age and when is that appropriate, and for whom?
American Academy of Pediatrics suggests nobody wears a mask under the age of 2. You have to be physically able to take the mask off. Occasionally, there's kids that aren't able to do that, even if they're older than 2. So obviously, siblings not in the house, but if you're out walking, I would suggest that the parents wear a mask. The baby should not ever have one on. And this is tricky. If your baby just comes home from the NICU on oxygen, or even not on oxygen, when are the grandparents allowed to visit? Do they have to wear a mask? My suggestion for that is nobody outside of the mom and her support person and siblings of the kid needs to see the baby until they're at least 6 weeks to 2 months after their due date. And if you're on oxygen, it's virtual, you can see the baby and you can do that, but I don't think, I mean, this is my own personal opinion, although with some backup, that you need to increase the risk of a premature baby who just left the NICU getting an infection by having a visit from aunts, uncles, cousins, especially children, and even if they wear a mask, even grandparents. That's my suggestion.
I'm sure you've answered a lot of questions with that answer, because that's very timely and certainly understandable, Dr. Lancy. That's very helpful. Thank you. Lori, this next question I think is also a great one for you, that if a family, and certainly you see and support and have been supporting NICU families for, as we said, 12 years now, if a family has a specific question, because we have some of those, about their baby or what their hospital policy or practice is, where do you direct them?
if you've got a question specific to your baby in your hospital, your first and probably your best point of contact for things like that is your bedside nurse. They're going to be the ones that give you the answers that are important and correct for your unit. They also will get to know you, they know your baby, and so they can really help with some of those direct questions. Obviously, you can also talk to other staff in your hospital as well, but I would absolutely put that as the place to start when you're trying to come up with some specific answers, just to a specific NICU.
Great, Lori, thank you. We'll have Dr. Lancy again join us in just a second again, but Lori, are there any other comments or questions or things you want to share before we wrap up? But Dr. Lancy will give you the same opportunity in just a minute as well. Lori, any final comments to any of our participants on today's topic?
I think just in closing, I mean, this is such a unique and unusual and crazy and stressful time where we're, I think, just in general being bombarded with information from a million different sources. So I think if you can find those resources, whether it be specific to your NICU, like a nurse, whether it be through classes like this as a March of Dimes, find those good, solid resources where you can get good information, and then remember to take care of yourself so that you can continue to be a good resource for your baby and kind of get home in a safe and healthy way for both of you. I think that would be my biggest takeaway at the end.
Lori, that's great. And Dr. Lancy, we're going to give you the last word here before we close. Any final comments or things you want to make sure that our participants take away from our time today?
I want to add to what Lori said about the bedside nurse as being an excellent source and the most immediate source to answer a question. But there is a doctor out there who isn't too busy to answer questions. He or she should be able to do that. I did it in a 40-bed unit, 50-bed unit. You can find the time. There should never be, well, the doctor's too busy to come and see you. That's a bunch of baloney. I mean, there is always 5-10 minutes, and sometimes it only takes that. The other thing that I have to say is if you are getting some information in a family meeting or the doctor said, I really want to talk, have another person there with you, COVID or no COVID. If you're hearing something, this is not for this discussion, but if I'm hearing something that says cancer, that's all I hear. I don't hear the other options that they're giving me. If somebody says grade 3 bleed, or if they say necrotizing enterocolitis, or if they say BPD, you're not, as a parent, going to understand what any of that meant the very first time. So you may need to hear it again, and you may need to have a second person there who can help out. So those are my big things. Get to know, don't take an excuse that the doctor's too busy.
We're going to leave it right there. And with both of you, I thank you both. The March of Dimes thanks you both for your time and your expertise in sharing such great information today. I also want to add my thanks to all of you for participating today. And on a final note, as we wrap up now, know that when you leave this webinar, there'll be a quick survey that pops up. And we are very eager to have any and all feedback from all of you who are here joining in this series today. So please take it's less than 2 minutes, and I promise you that it's less than 2 minutes because we've timed it. So it's less than 2 minutes to give invaluable feedback, and we would really, really appreciate that time. Thank you all for attending. Thank you all for being with us today, and most of all, have a great evening. Lori, Dr. Lancy, again, thank you very much. Take care.